fracture, we just need to make sure we've got all the bits that we want. So I'm very keen on using 6mm pins in the tibia. Right. We're also going to use a transfixing pin to go through the calcaneus as well. Okay. And then we're going to try and connect them all together. I'm actually going to use one of these bars to join the two proximal pins together because I want to use the extender bars on each side in order to connect down to the pins in the heel. So I'm going to need a drill again. So this one's built with my drill. Thanks very much.
No, it's not working.
So we're going to do things pretty much the same as we did for the tibial fractures. So you can imagine that we're going to make an incision in the skin, use a mosquito to get down to the bone. We're going to keep the drill cool. We're going to drill through the first cortex, wash it out with some saline, cool the drill down, go through the second cortex, wash it out, get rid of all the swarf. And then we're going to put in our pin. Brace.
Sorry.
So much for my glamorous assistants. So I'm going to separate these. And ideally, we could put this in right in the end. Separate them out as much as possible. So I've got my two proximal pins. I'm just going to tighten this right up by taking out these sleeves. No, I'm going to do it by hand. Okay, so that's the proximal end done. Now, I'm going to going through the calcaneus is very soft. It's almost all canceled bone, so normally you can just push this through. So I'm going to pre-drop this. Right, I'm going to look for the ankle joint. So the ankle joint, the axis is roughly between the tip of the medial and the tip of the lateral malleolus, right, within the talus itself. So I'm going to imagine where that line goes down, and I'm going to try to go as posterior as possible, so that as I drag the heel down, it's going to dorsiflex the foot. Okay. Now, of course, you've got to be careful about the neurovascular bundle on the medial side, but if you're very posterior, then you should automatically be avoiding that. Of course, the real calcaneus is actually a lot softer, and you can get through it very quickly. Right, have we got through it?
Yeah.
Good. It doesn't matter. And you want the thread to be in at least one of the vortices. Okay, so as I said, normally I would use a far bigger pin than this one. And now we're going to connect the two together. So we need a pin to bar. Thanks. I'm going to use the extender bars to go outside. Because I think they're so helpful when you get these multiple planes. So connect those together like that. Green to green. Thank you. So there's our basic construct. We can tighten everything up, and then I like to put in a crossbar as well. Sorry. Thank you. Right. So if you just let go, right. So you can see as we pull down, dorsiflexing the ankle. Yes. So the traction is actually removing the need for that pin in the first metatarsal. So I'm going to tighten that up there. There. And then we'll put a crossbar over there. And essentially, that's my construct. Okay, so it's not very difficult, but it's amazing how many different permutations you see, especially when I have patients referred to me with a Pilon fracture. It's all very straightforward. It's safe. It's reliable. You know, it removes the need for that first metatarsal pin. So, have you got any questions? Great. Okay.